How many times do you in a year say your six strategic imperatives? It's got to be millions of times.
I
If
would
you
say it's million. I thought about getting a tattoo, but then I would have to change that tattoo every couple of years. So that was a bad idea. So that came and went. But one of my mindsets is that we have to disrupt process, not the purpose. Right. So in this era of disruption for healthcare, it's really about disrupting processes, right? Not your mission, not your purpose. And so I think people can rally around that. Very simply put, when people understand the why, they can get to the how.
Welcome to Success in Chaos, a healthcare podcast where each episode is dedicated to unlocking success amid rapid change and uncertainty. I'm Angela Adams, the CEO of Inflow Health.
And I'm Candice Garcia, owner of Tungsten QI Partners and Quality Improvement Director of the ACR Learning Network.
We are so thrilled today to have Crista Durand, the president and CEO of Hospital for Select Care, on our episode today. She is Hospital for Special Care is one of the nation's most distinctive hospitals, serving both adults and children with complex medical needs. And we're going to get into what that means with Crista today. Crista is an absolute powerhouse leader. I met Crista a while back, and she is an inspiration both individually and a mentor to me. And she has been so helpful in helping my own leadership style. So I know you guys are going to get a lot out of this. She has a track record of driving results, which I know everyone on this call listening wants, in some of the healthcare's most complex environments. Her leadership style is clear, accountable, and deeply human. We've had that theme in many of the leaders that we've had on. And it is the kind that turns strategy into momentum and culture into outcomes. So we are so excited to have you, Crista. Welcome to Success in Chaos.
Thank you, Angela and Candice. It's a pleasure to be here. I'm very humbled by that introduction, Angela. So thank you very much.
Well, I think to start, let's get everybody kind of grounded on what the work is that you do yourself. So, can you share what makes Hospital for Special Care unique and why that organization is unique and how it shapes how you lead it?
Absolutely. So the Hospital for Special Care is located in New Britain, Connecticut, and we are the fourth largest LTAC in the country. So just by in terms of size and bed count, we're a fairly large institution. And what makes us unique is that we serve pediatrics and adults. Most LTACs are just adult oriented, and we do complex children. And we also have a nationally regarded autism program. So we are really regarded as both an LTAC and a specialty hospital. And I think that's what sets us apart.
That's super cool. As far as autism is related, are there many of those in the country or are you guys pretty rare?
So we are extremely rare. So we're about, I could do it on my hand. There's about five programs in the country that treat autism with behavioral needs the way that we do. So what started out as a very small program in 2012 as an outpatient clinic has blossomed into really a national regarded accredited program in which we treat inpatient children. We have a day hospital program, so kids come for part of the day, and then we have the outpatient program. So we treat the whole arc of care. We have 20 inpatient beds, and we probably, I would say, impact about 1,000 children and families in a year. And we have kids that come from 26 different states nationally because there's such limited services. As I mentioned, it's an accredited program. We do a lot in terms of physical rehab, speech rehab, occupational rehab. We have, recreational therapy, and I'd be remiss if I didn't mention our amazing pet therapy program, which really helps the children that are nonverbal.
That's incredible. And if I remember, it was the predecessor, your predecessor, right? Very mission driven to her family to start this program. Is that right? Am I remembering
That is
that?
That is correct. So the former predecessor had a deep connection and a family member who was autistic, and really, it was a mom's mission on how we can provide care in Connecticut and beyond for children with just such limited resources. And so this program, like I said, we get kids from 26 different states across the country, and we're looking to expand geographically, which we'll tie into later, part of our conversation on our plan on a page and our strategy.
I mean, it is so wonderful to see somebody's vision, somebody's passion turn into a multi-coordinated national program. I think it's really the what we forget sometimes about healthcare. We feel so stuck in the way that we're doing things, and we feel so stuck in the systems that we have. But with a little creativity, a little bit of drive and passion, and a lot of planning and organization, you can really make something really incredible for our patients. Tell me a little bit about your method. So I love structured process. I know that, the only way to meet chaos is with structure. And you are known for your POP, your plan on a page methodology. So tell us a little bit about where did that come from and why has simplicity been such a powerful leadership tool?
Yeah, so I have a mantra and it's going from good to great to Olympic in everything I do. So whether you're planning a trip to Greece, or you're planning a strategic plan for a multi-million-dollar healthcare system, it all starts with a written plan. So I started using the POP or plan on a page about 15 years ago, 3 organizations ago, when I was the vice president of strategic planning for another Connecticut hospital. And I was introduced to that. And so through my journey, I've been in healthcare for about hate to say this, about 3 decades. You really need structure, right? And so there's a mantra in healthcare: if it's not written, it's not real, it doesn't exist. And that extends to medical records, human resources, finance, and it also extends to strategy, right? So I've worked in other organizations where strategy wasn't necessarily formalized. And what makes the POP or the plan on the page so unique is it literally is an 11 by 17 document that has your organizational domains on the left. It has what's your North Star, all of your tactics and measures. We use the RACI format, right? By executive leader, responsible, accountable, consultative, or inform. And then you have your KPIs, your key measures of success. What year are you going to launch the tactic? And then we typically trend that on an annual basis. So, what I like to do with the plan on a page or the POP is it's a 3-year plan. And then you back that up with annual work plans, right? So, you want to you want to break it down so that it's very clear and concise. And then you have your annual work plan. And then off of the annual work plan, I typically take off the 6 strategic imperatives and we plaster that in the organization. So everyone, whether you're a frontline staff member, you're a board member, you're a community member, these are the 6 things that we're working on. This is where your manager's spending your time. This is where the CEO is spending their time, physicians, et cetera, et cetera. So it becomes a very livable, breathable document and process and really guides the organization.
I've seen so many organizations try to do this, like the spirit of it, or like the structure and like the point of it, I think is there, but the application and the dissemination to the frontline staff has always been a challenge. Even when I was a frontline staff at a couple of hospitals, I was like, yeah, okay, I hear the words, but I don't get what you're talking about. How do you get them to really live the strategic plan? How do you get everybody to kind of not only buy in, but understand how they're supposed to participate from where they stand?
So that's a great question. And for me, culture drives everything, right? So the culture will only move as fast as it trusts. So I've learned that in leadership throughout the years. And so it's important that foundationally, where is the organization, right? Is the organization, do they have the readiness? Are they aligned? And then you have to meet people where they are. I think that's really important. So my style has been, again, a 24/7 organization, 365 days, we never close. How do I, connect with 1,400 employees and then add, several hundred medical leaders on top of that? So it's through a very structured, deliberate communication plan. So we post it in every single department. I'll start with that. A little, 8.5 by 11 laminated. Here's the 6 strategic imperatives. Every town hall meeting, these are the strategic imperatives. We record our town hall meetings. Then I do a biweekly newsletter called Inform. We do breakfast with ELT, which is the executive leadership team, and we have the strategic imperatives. I share it at my provider coffee talks. So we do those on a quarterly basis. And then we have Info Row, which are TVs, which sort of scroll all the things going on in the organization. And we have Tuesday announcements. And I could go on and on. And so it's really having a very deliberate, structured, intentional communication plan to say, this is what we're working on. And I think the other just point that I want to make is that POPs or strategic plans are fluid, dynamic documents. So if something changes, right? Let's take COVID, for example. So when things like that happen, talk about, organizing or managing in chaos, you might have to pause certain strategic initiatives because of circumstances. So you have to be very agile in this type of leadership, I would say, philosophy to make the POP and make the strategic imperatives very livable and readable.
Gosh.
How many times do you in a year say your six strategic imperatives? It's got to be millions of times.
I
If
would
you
say it's million. I thought about getting a tattoo, but then I would have to change that tattoo every couple of years. So that was a bad idea. So that came and went. But one of my mindsets is that we have to disrupt process, not the purpose. Right. So in this era of disruption for healthcare, it's really about disrupting processes, right? Not your mission, not your purpose. And so I think people can rally around that. Very simply put, when people understand the why, they can get to the how. And so that's how I like to break things down. And I want pushback, right? So you, as a leader, you want pushback to say, Krista, why are we doing this? And then you kind of explain what the why is. Oh, yeah, that makes sense. Now I can help you get to that how.
I love you're highlighting so many ways that you're communicating with your staff. I think people think communication is, oh, let me send an email. Oh, let me put it up in the room. But no, communication is really, I like to think of it as like the circulation system of your body, right? The information has to continuously circulate, and it's not just giving them information, but getting back. And what I heard you say is, it's not just putting it on the wall, but it's having a conversation about it. It's having a place where we can discuss it, where we can talk about the real problems with living these strategic visions, because it's not as straightforward, and it requires conversation and a constant vigilance of how is it working for you? Should I change? Should you change? Should we change? And I think that is where leaders sometimes miss the mark, is that they don't think of it as an ecosystem of communication that is of constant it, that is the job. The job is the constant communication, and then supporting and empowering your frontline staff to do what they want to do. The way that you described it is just so beautifully well-rounded. I just It feels so refreshing to see that, but it does feel like work that is not work. I think a lot of the time we feel like it's extra or it's like not necessary, but at the end of the day, it really does feel like the most important thing.
I think I completely agree with you, Candice. And I would add that it's also about bringing the energy to it, right? So you want it to be, so if you want something to be breathable and livable in the whole ecosystem of your organization, you have to bring that energy. And someone like me I don't drink a lot of caffeine. I've never had a cup of coffee. That's a Krista fun fact. I don't need the coffee. I like tea and occasional Diet Coke, but it's also about how, the leader needs to bring and infuse the energy into the organization and the direction. I think the other piece I'd like to add in terms of tactics is just intentional rounding. I like to get out of my office. Me, the CMO and the CNO, we're known to do Friday roundings. And so you connect with staff, you connect with providers, how are things going? It gives us the pulse of the organization. And the other thing I like to do is when I'm meeting with staff is I say, how many people have seen our strategic imperatives? Raise your hand. And then it gives me a pulse on how well we're doing with getting the communication and pushing it down as well.
That's great. That actually is in line with my next question. I feel like I've seen so many organizations, to Candace's point earlier, make these big strategic plans for the year. And it's not necessarily a living document. And there's a big disconnect between what the leadership thinks that they're doing and what the end user staff thinks that they're doing. So it sounds like you came up with all of these like communications, but can you give us an example of like a way that maybe something started out on the strategic plan, on the POP plan at the beginning of the year, and you had to evolve it because of this feedback loop? Can you give us an example of like that in
Absolutely.
motion?
Yeah. So that's a that's a great question, Angela. And I'm going to respond with I'm going to reflect back into my COVID years. I still have PTSD, but I'm doing better. So
Yeah.
during the COVID years, being the CEO of an organization, you're definitely leading in uncertain times, right? Like we really didn't know what was going to happen. And what happened to all organizations across the country? Employee engagement tanked. No matter what you did, it just tanked. And so we had a strategic plan and we had an employee engagement, that was a large section of our plan. It wasn't working because we couldn't connect with our staff. So we kind of took a step back and we asked the staff, what can we do to drive your engagement to further align into the organization? And they said, we want to see you more, Krista. We want to have some sort of forum with you and HR so we can talk about the good, the bad, and the ugly. And this was a very big risk for me as the CEO to be very vulnerable, to be with frontline staff. And so I said, I'm going to throw myself into it. We're going to do it. It was probably the single best tactic I did when I was the CEO of Newport Hospital. We had what was called the President Advisory Council, affectionately known as the PAC. And there was a wait list to get on the pack after it got up and running. So we started during COVID, and I think in the 4 years, accomplished more than 100 different tactics that I never would have known if I hadn't sat down directly and broke bread with frontline staff. And how do I know it was successful? So our employee engagement over the 4 years of having the pack eclipsed the national average. It was really leading the national average in employee engagement. And I couldn't have done it if it wasn't for the folks in environmental services, nursing, the emergency room, facilities, et cetera, human resources, and the list goes on and on. So I think as leaders, a lot of times we're afraid to be vulnerable. And by doing that, I create a deeper connection to the organization, but yet I had a deeper appreciation for my entire workforce and what they needed to do. And the last point that I'll make on that is that was at a time where workforce safety was really heightened in healthcare. And we deployed a lot of tactics, again, that I would never have known about that were in our strategic plan. And so that came out of the President Advisory Council forums. And I hope to launch that soon here as well.
I love the President Advisory Council, but you're right. We hear this theme over and over as we have leaders on, Candice and I. It's like leaders going first, you being the first to be vulnerable, and then that creating the culture in the organization for other people to step forward and be vulnerable and break down those walls. That's incredible. So tell us a little bit more. You said there was a waiting list to get on this. So
Yeah. So so let me explain the process. So all you had to do, I wanted to make the process very simple. For the first year and a half, we had to do Zoom meetings and it was really hard. And then I kind of broke out a little bit. I'm like, okay, we'll go in a big room and we'll have masks on, and that worked. And then it came on to, sitting in a boardroom shoulder to shoulder. So basically employees just sent me an email, how to emulate the care values. And as long as they were in good standing, and I didn't want all the excellent employees. I wanted some rebel rousers on the President Advisory Council. And I got some. And so after a year, their membership, would end. And then I'd have to recruit 12 more. And so once it got traction, things are happening. We're seeing movement. There's workforce safety. We've changed the parking lots. We've enhanced this. We built a mindfulness center. We have a bright ideas program, and the list goes on and on and on. It got a lot of traction. So one of the staff members said to me, it would be helpful as we're transitioning people off the PAC, let's keep a few of us on so we can be quicker and more agile to onboard the new sort of crop of employees. And we did that. And then at the end of their year term, they had to give me a survey. So it was my report card. How did I do? And this one employee, I'll never forget this story. I was at the elevator. This one employee, she'd been there a very long time. She was very opinionated. And she came up to me and you never knew what she was going to say. And she looked at me and she said, you know what? She's like, that PAC was a good thing. And you are the most approachable CEO that I've ever worked here. And I've been here for 30 years. That's impact. And that's how I knew I made an impact in the organization.
that's
Yeah, this is the kind of leadership that oh, go ahead. Sorry.
no, no. I was just like, that's incredible. It's just something that we haven't heard before, Candice and I, as an idea. And I think that you're really onto something. I think the rebel rousers, as you called them, a lot of CEOs would try to kind of cherry pick the best people to come on there for the least friction. But the fact that you had the rebel rousers in the room, I love that term, by the way. I'm going to use it all the time now. I think they can either be your strongest critics, but then once you turn them, they can be your strongest supporters. And the way that you gave them that forum, I'm sure, is what created, either they can be kind of a cancer that's sitting in the background, getting all of the staff to go in a negative direction. Or if you can bring them into the conversation, they can be part of the positive change. But it's like, how do you get them to the table in a healthy way, give them an outlet that doesn't disrupt everything, And I think you found the perfect blend there.
Yeah, so I'll say that, I learned something a few years ago. I think it was the University of Houston's basketball coach. They talked about his team. He got to the Sweet 16. They weren't the most talented team. And he's like, what is so special about this team? He goes, it's simple. We water the roots, not the leaves. And that goes back to culture, right? So find out what motivates people. You want to make people feel valued. So the pack was so successful because I listened, right? So I listened and I sat back and said, I'm here. They're telling me a lot of the stuff was simple, was low hanging fruit, but no one had ever fixed it. And so it's really about, actively listening, being vulnerable, and quite frankly, delivering results. Every job that we have, right? You're hired to produce an outcome. So whatever that outcome is, it's being a good partner and listening with your staff, and just remembering you got to water those roots.
I think this is the leadership that we're all craving in healthcare. When we are working on the front line, these are highly educated people. People have master's degrees and, you know, doctors, and everybody is so smart and so capable. They manage patients all day long. So they are all individual managers all the way down to the frontline house cleaners. And I feel like often in healthcare, we promote people without an understanding of what true leadership could
Mm.
look like. And they feel responsible for making all the decisions. They feel responsible for being like, we need a wellness center. We needed this. We needed that. When really effective leadership in healthcare is turning the table and saying, hey, I'm not here to tell you what to do, but I'm here to cultivate ideas from you and then enact those in the greater good for all of us. And I feel like what you have been doing is this real necessary shift for all of our leaders of that. I mean, we say it's the top down leadership to the bottom up, but the bottom up really is about cultivating, it's about empowering, it's about understanding that everybody here actually can participate in your leadership in such a meaningful way, which means the hospital is better, everybody feels better, everybody wants to participate, and it's actually brings a little bit of joy back to work. How did you how did you become this kind of leader? Have you just always been like this?
So I come from a very humble background, and my parents were both teachers. So I have teaching. I guess in my DNA, I didn't realize that I did till much later in life. And so being a lifelong learner, so I've gone back and I got an MBA. I'm a fellow with the American College of Healthcare Executives. I like to attend national conferences. I read a lot of books, a lot of leadership books. I like to really understand and get under the hood with culture, and it's all about teachable lessons. And I think even when things don't go so well, I say to myself, what was the message, and what was the teaching? What was that bad situation trying to teach me? So myself, I think inherently I always want to be better. Again, how do I go from good to great to Olympic? So it's reading, it's learning, it's um stretching myself and stretching others. And, if you asked me, what do people always say, what's your superpower, Krista? And I would say that people would say that mine is x ray vision. So I tend to see things in people they can't see in themselves as well as organizations. So I think that that's my superpower. So it's all about cultivating talent around you, right? So I don't have all the answers, I don't have all the skills. And so it's cultivating a leadership team that's like minded to me, but has very different skill sets. And how do we continue to learn together and skill each other up?
So tell me, you had this locked and loaded at Newport, then you switched to a brand new hospital. You come after a great CEO that had been in place for decades. Where do you start? We have a lot of leaders that listen to this podcast, and they crave like real actionable plans and mindset. Like, do you work on culture first? Do you work on strategy first? Does it have to all come together? Like, you go to a new org like you just did. How do you kind of create this environment, even though you're brand new to many of them? They don't know you, they don't know your style. So how do you come in, or even for our leaders that are listening, how do they start to make this change at their own organizations?
Yeah, so that's a great question, Angela. So I think when you start in an organization, it's all about listening. So I did a listening tour. So I interviewed board members, leaders, medical staff, and I asked everybody the same questions, right? What's going well? What's not going well? What do you want to see change? What advice do you have for me? Then I collate that information, get the themes, and then you push it out to the organization. In addition to that, I did CEO focus groups with frontline staff. The same thing. What's a good day look like to you? What are the problems in the organization? How can I support you? And so again, you collate all that information and then you put action plans together and you go forth and do good. So it's really about relationships, right? Healthcare is a relationship based business. Medicine is a team sport. So I think I said at the beginning that the culture will only move as fast as it trusts. So you have to build some credibility. You have to get some quick wins in. And by having those structured forums where people can come in, and again, it takes time. There's always going to be folks that, speak out and say, this is awful or this is great. And then you can make your own assessments, but it gives you data, right? So it's giving me data points about impressions and thoughts. And, what's great about HFSC is that for the last 13 years, we've been a top performer in terms of employee engagement, but we can always go from great to Olympic. So, how do we get to that next level? So, by listening to the staff, and then we put together this past year under my leadership, department specific action plans, which they had never really formalized. So now each department has here's the top 5 strengths. Keep doing those things. Here's the things that I'm not so good at. So here's the things I need to improve upon. And then we had a 90-minute roundtable conversation with all the leaders so that we could exchange learnings. So these, you learn these tips and tricks from other executives, attending conferences, reading. And so you do what works. And if it doesn't work, then you fail fast and then you try something else. But I feel like when you're going into a new organization, you really have to be on the listening front before you can start truly leading.
Incredible. I love all of this. Tell me what your vision is for HFSC. I think you've got big dreams. I think the organization does. Tell me a little about where you guys are headed.
Yeah, so I'm really excited that I've recruited some great folks that I've worked with in the past that have come here that know how I work and think. And one of those individuals has helped shape the strategic plan. And so we're on the cusp of seeking board approval for a 3-year bold and provocative strategic plan to really expand and grow, right? We need to be in growth mode, really on the outpatient side with, I think I mentioned our autism program. We have a very robust neurosciences and movement disorder program here, as well as outpatient rehab and some other things. And then on the inpatient side, we really want to formalize that patient experience. I've heard a lot since I've been here that we're the best kept secret in Connecticut and beyond, and I don't want to be the best kept secret. So what's unique about LTACs, right, is you don't think about long-term care unless you need it. But we are also a specialty hospital with our autism. I think we're the second or third largest ALS programs in New England, also an accredited program. So there's a lot of uniqueness in this institution that we want to shout from the rooftops and make sure that when you need specialty care, you think of HFSC.
No, that's amazing. So if anybody is listening to this and they're interested in either the autism programs or the ALS programs, like how do you make that accessible for the public? You said 26 different states are sending kids into this program. Like how do people access you?
Yeah, so we have a pretty large social media presence. So we're on LinkedIn, we're on Instagram, Facebook. We have a robust website, and we're also going to be doing a rebranding to expand that even into more social media channels and things of that ilk. So there are lots of ways to get to know HFSC a little bit better. The other thing I'll mention, which is unique to Connecticut, and bravo to Connecticut for doing this. So there is a system in Connecticut in emergency rooms that if the children if they're having a significant behavioral crisis and they're autistic with a diagnosis, then there's a pipeline to us for admissions. So that's a well-oiled machine and unique to Connecticut. So again, just a great way of doing that to make sure we're funneling children that are having behavioral challenges with their diagnosis to get right to HFSC. I'd love to expand beyond Connecticut. So that's definitely something that we're going to be looking at, as well as virtually and geographically. So stay tuned for more in the next 3 years to see what we can do.
I love it. I'm excited to hear what you're able to do. I think with all of your amazing leadership style and skills, like you've taught me many things just in the years that we've known each other. But I just, for the audience, want to go through a couple things that you said just to make sure that they got them. Um, One of the first things that you said, which I love, is good to great to Olympic, which is like, that is a great way to view it. Um, If it's not written, it's not real. Another Krista-ism there. We need a book of Krista-isms here. You wanna disrupt the process, not the purpose or the mission, which I love. Culture only moves as fast as it trusts, which is so empowering. Yeah. And then in previous conversations, you've always said, and we say it to each other, pressure is a privilege. Sometimes, as leaders, we get a little bogged down, and you can't always be at the top of your 100% Krista energy. But it is a good reminder when we're in those moments as leaders where we're just exhausted and we need energy and we need things poured into us to remember that like pressure is an absolute privilege. And so anything that you would love to leave the audience with, I mean, you've given us so much to think about, but anything that you would love to leave the audience with on like just advice from one leader to another.
Yeah, I think a couple things sort of resonate to me, and these are just they're not I didn't really make up these expressions, but they've served me well in my career is that the pancake, no matter how thin, has two sides. And an early mentor gave me that advice, and I have treasured it throughout my career because I think as leaders, we're quick sometimes to make a decision or rush to judgment versus getting all the facts and perspective. And I think as a CEO, many times you are in the moment and you have to make a just in time decision, but just to take a step back and pause and say, could there be another perspective or another angle to this? So that has I live and breathe that every day. The second piece of advice that I would have is that leadership takes courage. So being able to stand up, offer either a different opinion or a very different perspective, I think is super important today in leadership. That it's the diversity of the points of view, which typically that generates innovation. And so that would be the second thing. And my last piece of advice is about integrity and do what's right, not what's easy. And my parents instilled that to me at a very young age, and that's about character and integrity, and that is something that I firmly believe in.
Oh, I feel like I wanna go out and change the world. Like, I wanna go change the way I'm doing things. I'm gonna, like, meet with my team today and be like, "All right, everyone, we're doing this from our hearts." I mean, that's what we love anyway. I love this type of leadership. I love this type of showing up. It just feels so connected to who we are in our humanity that, it feels weird that we would do it any other way. Um, okay, so you told us like so much advice. Any books, any resources, anything
So
that
again, being the planner that I am, of course, I have a couple books here. So this book is fantastic. It might be a little hard to see. It's called Ambitious, and it's The Power of Low Ego and High Drive Leadership by Amar Kasi. So someone else told me to read this book, and it is great. And I think we learn a lot through the power of storytelling. It's an easy read. Highly recommend it. The second book, which I love, is by John Maxwell, and it's The 21 Laws of Leadership. I could this is the one I pick up over and over again when I'm stuck or frustrated. Really great book, timeless. It's just simply awesome. So those would be the two books that I would recommend. And the last thing I would be remiss if I didn't mention is I started doing this, which is a little cheeky. I'm doing something called CEO pop-ups. So just like a pop-up store, you never know where Krista's going to pop up. So I have usually candy and trivia, and there's like no agenda, and I'm like in the organization just connecting with people, usually around lunchtime, and we have another satellite. And so I've started to do that and try to connect it to holidays or themes, and just another touch point that I can have with the folks that come in every day. They get up and they dress up and show up for each other, for our patients and community, and it's just very rewarding.
That is
you're so
awesome. Incredible. And tell me in closing, you have a CFD moment if I follow you on LinkedIn and
I
I see
do.
your puppy, tell me about that.
Yeah, so I run with my dog Sky. Really, who's running who? But she's a 6-year-old Vizsla Hungarian Pointer. I just started doing this thing about a year or so ago, and running. And I don't run with music. I like that's what my decompress time. And so Sky and I will just post about a minute or so about a leadership tip. And I ended the year with pick a word. pick a word that you want to grow and develop on. And my organizational word for 2026 is focus. Focus out craft underpins success. So focus is one of my words. And the second word that I'm going to use is elevate. Again, how do we go from good to great to Olympics? I want to elevate. So tune in to CFD Moment of the Week. You can see Sky and I are running, whether it's raining, snowy, or sunny. We like to get out there, and that's one of the ways I charge my batteries.
Absolutely. I can't wait to connect. Thank you so much, Krista. This has been amazing. Um, you know, we get to talk to leaders all of the time, and I think that this is probably been one of the most inspiring conversations I've had with somebody. So thank you so much for joining us.
Thank
It's been
you.
really great.
Thank you.
All right. And thank you, audience, for joining us in Success and on Success and Chaos. Be sure to like, follow, and share today's episode on Spotify, Apple Podcasts, YouTube, or wherever you get your podcasts. And a special thank you to the Inflow Health team for their production support.